Liver health in older adults, gentle signs that shouldn't be ignored. As we grow older, taking care of our health becomes more important than ever. One of the organs that often goes unnoticed until problems arise is the liver. This hardworking organ quietly supports nearly every system in the body, from digestion to blood filtration, from energy storage to hormone balance. Yet many people, especially older adults, are not aware of the signs that the liver may be in trouble. In this article, we'll gently walk through the early warning signs of liver problems, explain why they happen, and offer guidance on when to seek medical attention. The goal is not to alarm, but to help you understand your body better so that you can care for it with greater awareness and confidence. Let's begin with a closer look at the quiet but vital role of the liver. 1. The liver, your body's silent caretaker. The liver is located in the upper right area of your abdomen, just beneath the rib cage. It's one of the largest organs in the body, and it's involved in more than 500 essential tasks. Here are just a few of the important things the liver does every single day. It filters the blood, removing toxins, waste, and harmful substances. It helps digest food, especially fats, by producing bile. It stores energy in the form of glycogen and releases it when needed. It processes medications and breaks down alcohol. It helps in clotting the blood to stop bleeding. It supports the immune system. Despite doing all this and more, the liver rarely complains when it's struggling. That's why liver disease is often called a silent condition. By the time symptoms become noticeable, the liver may already be significantly affected. However, there are early signs, subtle changes in your body and energy levels that can serve as gentle nudges to pay closer attention. Let's explore them. 2. Fatigue that doesn't go away. One of the earliest and most common symptoms of liver trouble is a deep, lingering tiredness. This isn't the kind of fatigue that comes after a long walk or a poor night's sleep. It's a persistent, overwhelming sense of exhaustion even when you've rested well. When the liver isn't functioning properly, toxins can build up in the bloodstream. This buildup can affect the brain and nervous system, leading to mental fog and fatigue. The body also becomes less efficient at converting nutrients into energy, making you feel drained. If you're constantly tired without a clear reason, or if you find daily tasks more difficult than before, it's worth bringing it up with your doctor, especially if you're over 60. 3. Discomfort in the right side of the abdomen. Mild, dull pain or a feeling of fullness in the upper right side of your abdomen can be a sign that the liver is inflamed or enlarged. This area is where your liver sits, and while pain here doesn't always mean something serious, it can be one of the early physical signs of liver strain. Some people describe it as a pressure or tightness rather than sharp pain. It may come and go, or feel more noticeable after eating. Because older adults may already have digestive issues or muscle tension, this kind of discomfort is easy to overlook or attribute to something else. But it's a good idea to be aware of this sensation and note when it appears. 4. Yellowing of the skin or eyes, jaundice. One of the more visible signs of liver issues is jaundice, a yellow tint to the skin or the whites of the eyes. This occurs when the liver cannot properly process a substance called bilirubin, which is produced when red blood cells break down. In a healthy body, bilirubin is processed by the liver and excreted through the stool. But when the liver is damaged, bilirubin builds up in the blood, causing that yellowish appearance. Jaundice should never be ignored. If you or someone close to you notices a yellowing of the eyes or skin, it's important to seek medical attention as soon as possible. 5. Changes in urine and stool color. Another set of signs to watch for involves changes in the color of your urine and bowel movements. These changes may seem minor, but they can point to deeper issues in the liver or bile ducts. Dark urine that looks brown or tea-colored can indicate an increase in bilirubin levels. Pale or grayish stools suggest that bile is not reaching the intestines properly. These changes might occur before jaundice is visible. If you notice unusual colors that persist for several days, especially along with other symptoms like fatigue or abdominal discomfort, it's a good idea to talk to your doctor. 6. Itchy skin without a rash. Some people with liver issues experience itchiness across the body, especially on the hands, feet, or back. This itchiness is not caused by dry skin or allergies, and often there is no visible rash. This symptom is believed to be linked to bile salts building up under the skin when the liver isn't functioning well. It can be quite bothersome and interfere with sleep or comfort during the day. If you experience unexplained itching that doesn't respond to creams or moisturizers, consider discussing it with a healthcare provider. 7. Swelling in the legs, ankles, or abdomen. Fluid buildup, known medically as edema, in the legs and ankles, and ascites, in the abdomen, can occur when the liver is not working properly. This swelling can be mild at first and easy to miss, especially in older adults who may already have circulation or joint issues. Over time, the swelling can become more noticeable. You may see sock marks left on your legs at the end of the day, or your pants might feel tighter around the waist. These signs suggest that the liver is struggling to manage blood flow and protein production, leading to fluid retention. 8. Bruising and bleeding more easily. The liver plays a key role in producing proteins that help your blood clot. When the liver is damaged, it may stop producing enough of these proteins. As a result, you may bruise more easily or notice that cuts take longer to stop bleeding. You might first notice small purple spots or bruises after light bumps. Or your gums may bleed more during brushing. While these symptoms can have other causes, especially in older adults on medications like blood thinners, they should be discussed with a doctor to rule out liver issues. 9. Nausea and loss of appetite. A lack of appetite, especially when combined with nausea or bloating, can sometimes be linked to liver problems. When the liver isn't working efficiently, digestion slows down, and toxins can affect the gut. You may notice that you feel full quickly when eating, or that foods you once enjoyed no longer appeal to you. In older adults, a reduced appetite is often assumed to be part of aging, but if it's a new or ongoing issue, it may point to something more specific like liver dysfunction. 10. Mental fog or confusion. The liver helps filter toxins from the blood. When it's not functioning well, these toxins can reach the brain and interfere with cognitive function. This may lead to symptoms like forgetfulness, difficulty concentrating, mood changes, confusion, especially later in the day. This condition, known as hepatic encephalopathy, can be subtle at first. It may look like normal aging or mild dementia, but it's actually treatable if the liver issue is addressed. Understanding the causes, why liver problems happen. There are many reasons the liver can become damaged, and understanding them can help in both prevention and early detection. Some common causes include fatty liver disease, which is often linked to being overweight, having diabetes, or high cholesterol. Hepatitis, a viral infection that damages liver cells. Excessive alcohol use, even in small amounts over many years. Medications and supplements that can affect the liver, especially when taken long-term. Autoimmune conditions where the body mistakenly attacks the liver. It's important to remember that liver disease can affect anyone, even those who don't drink alcohol or have obvious risk factors. When to see a doctor. If you notice any of the symptoms we've discussed, especially if they appear together or persist, it's wise to speak with a healthcare provider. Early testing can help determine whether the liver is under strain. Tests may include blood tests to check liver enzyme levels, ultrasound or imaging to look at liver size and structure, fibroscan or biopsy in some cases. These tests are usually simple and non-invasive. And the sooner a problem is found, the more options you have for treatment and lifestyle changes. Caring for your liver gently. Even if you've never had liver problems before, there are many simple and gentle ways to support your liver's health, especially in your 60s, 70s, and beyond. Maintain a healthy weight, as extra fat around the liver can lead to fatty liver disease. Eat a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Limit alcohol or avoid it altogether. Be mindful of medications, especially over-the-counter pain relievers like acetaminophen. Stay hydrated and active, even with light walking or stretching. Your liver works for you every moment of the day, even when you're sleeping. Taking small steps to care for it can add years to your life and life to your years. Conclusion: listening to the gentle whispers of your body. Our bodies are wise, even as they grow older. They often whisper before they shout. The signs of liver trouble may be gentle at first: fatigue, mild discomfort, a yellowish tint in the eyes, but they are meaningful signals worth paying attention to. By learning to recognize these early signs, and by treating your body with care and kindness, you can protect your liver and support your overall well-being. If something feels different in your body, don't hesitate to ask questions. A gentle conversation with your doctor could be the beginning of renewed energy and peace of mind. Because in aging, just like in life, awareness is one of our greatest tools.